Yes, hello, everybody. Yeah, good afternoon again. Welcome, everybody, to our Facebook Live. Yes. Hello. How are you? Okay. Welcome. Thanks for joining. Yes. Hello. Okay. Yes, ladies and gentlemen. Yes, welcome to our Facebook Live again once a week. Yeah, on Facebook every Wednesday, 1 to 2 p.m. is our time here, sharing, chit chat, answering questions. And talking about what is the misunderstanding things. That you always thought of. Or recollecting. Okay, the thinking that you had before. So today we will be talking about this melasma. How to cure melasma? Yes, everybody. If you are facing melasma, okay, or if you do not know what is melasma, stay on. Today we will let you know everything about melasma, okay, and how to cure melasma instead. Yeah, ladies and gentlemen, okay, welcome all your questions. Tag to your friends, share to your friends about our link. Let more people see us so that more people benefits from this education. Okay, today's topic is not to sell things. I never been here to sell things or to promote anything, but it's to let more people understand, to let more people get the right knowledge about the problems that they are having. And today's topic focus will be on this condition called melasma. Yes, bahasa Melayu nama dia jelagat. 华语叫做黑斑、黄褐斑。OK，福建话叫凹斑。OK，so ladies and gentlemen, OK, don't wait, share and tag to your friends. OK, so for those who are having melasma, welcome, stay on, ask all the questions that you have. Don't simply do treatment for melasma if you don't understand. Maybe you are not doing the right thing. Okay, or if you are doing something which you may see improvement or may not see improvement yet. Okay, what should be the proper understanding? Okay, today we will share everything. Okay, no secret cap. Will tells you everything that we know, all our experience, all our to those who are just joining us, welcome again to our Facebook Live. Before we start about melasma cure, okay, let's talk about what is melasma. There are probably certain people who do not know what is melasma. Okay, let's see what is melasma. If you have certain patches of pigmentation on your skin, okay, sharing a little bit of my experience. There are patients asking me what is the difference between pigmentation and melasma. Okay, so this is like us. Okay, so there are people asking me what is the difference between pigmentation and melasma. Okay, is that asking, okay, what is the uh, product sell in supermarket? Okay, or what is the difference between supermarket and a can of water? The can of water is sell inside the supermarket. Okay, so melasma is a kind of pigmentation. All right, so pigmentation means something wrong with your skin pigmentations problem. When the pigmentations become disorder, means it may be too dark or too white or irregular or uneven, then is considered pigmentation problem. But among so many type of pigmentation problem, melasma is one kind of it. Okay, and this is the most stubborn pigmentation that a lot of people facing, especially in Asian, in Oriental country, okay, or if you are Asian Oriental kind of genetics, okay, then you are probably higher risk to get melasma. Okay, so before keep on talking, okay, what is melasma? a lot of people may not know. Okay, let's share a bit of photos. If you have this kind of pigmentations on your skin, yeah, this is one kind of melasma. Melasma also of different kinds, okay, different patterns. Yeah, but how to get to know whether your skin is a melasma or not? Usually, the characteristic is the pattern of pigmentation, the color tone, yeah, the distribution, yeah, and also the age of the patient, and also the quality of the skin is the determinants of factors to determine whether your pigmentation's problem here is a melasma or not. Okay. All right. So this is a photo of melasma. This is also a photo of melasma. If you can see pigmentation along this area and also on the side here, and also have the shadows of pigmentation on the lower buccal area. So this is also pigmentations like melasma. Okay, yes, patchy, small one. Yeah. And also this is also melasma. Okay, yes, older patient. Yeah, this is also patchy. Yeah, very uneven distributed. It's also a kind of melasma. Okay, sometimes early phase of melasma you do not see the full blown color, but you see some small specks of pigmentations. Yeah, and the color is light brownish. Okay, and irregular, and sometimes you can't really define the edges. Then these are the common characteristic of melasma. Okay, this is also a kind of melasma. You can see a shadow of pigmentation here and also a bit here. This is quite classical because the distribution, the area of the face that has the pigmentations are very classical as a common melasma. Okay, this is also sometimes when you close up and have a look, then this is melasma. Yeah, if it is like seeing from far, probably you will see, oh, this is like maybe uneven color tone or sun tanning, things like that. But this is melasma, yeah. Okay. Very fast. So we have shared so many photos of this melasma. Let you see again what is melasma. Okay. The characteristic of melasma usually starts in a lady as early as like age 20, mid 20 or early 30s. Yeah, but most commonly it starts about late 30s. Okay, most of the ladies started to have melasma after their pregnancy, maybe first pregnancy onwards, or maybe on their subsequent second or third pregnancy onwards. Then they started to have melasma, and they always concern whether, oh, my mother has it, then would I have it? The risk is there or not? It's not really because of mother have it, then your genetic is there, but it's the skin type. Okay, you can say genetic also, but it's a skin type. Yeah, it's not saying that you must have it, but your skin type same as your mother, then probably you are higher risk, yeah, to get the melasma. Okay, but how to prevent it? Yeah, how to cure it? How to prevent it? Later on we'll discuss. Okay, so usually mid-age, yeah, early 30s, always has a patches of irregular, uneven color pigmentation over the cheeks, and this pigmentation always, yeah, very light. Sometimes started after you are stressful, after your pregnancy, or during your pregnancy, or after your menses, or after you started on certain kind of supplements or hormone supplements. Yeah, these are the commonest scenario we found. Those ladies who have melasma, and their melasma also started just, I mean, after menopause. Yeah, there are ladies who have melasma only during their menopausal age, meaning to say when they are near to the perimenopausal or after menopause, then only they started to have this melasma issue. Okay, so these are the scenario. If, ladies and gentlemen, if you do have those scenario, okay, then you may suspect yourself whether you have melasma or not. Yeah, so who, for those who are just joining, yeah, welcome. Yeah, thank you for joining us here in our Facebook live on every Wednesday 1 to 2 p.m. So today's topic about curing melasma. Okay, so before we want to talk about curing melasma, these are the types of melasma. Okay, if you have this kind of pigmentation somewhere around your mid-age, early or mid-20s or early mid-20s or early 30s, yeah, after pregnancy, after hormonal pills, yeah, after your certain triggers like products or sun tanning. Okay, sometimes you will notice that melasma is a very characteristic where you will notice that when you are under a hot environment in your kitchen, after a hot shower or sort of like sun exposure, your pigmentation get worse, flushing. When you cool down, when you wash your face, then your pigmentation lighten. So if you always have this kind of issue on your skin, means you are having melasma already. All right. So this kind of pigmentation, irregular, light brownish, always on the cheeks area, it can distribute up to the foreheads, yeah, on the side here, above our eyebrows on both sides. It can also goes towards our nose bridge, yeah, around the eye corner. These are the very difficult and challenging part, very stubborn areas where if you have melasma, very challenging to treat. And most common is over the cheeks, yeah, and also the front cheeks, and sometimes can grow over the beard area. Ladies will hate it because it looks like a misai. And also it may grow over the buccal area, sometimes over the lower jawline as well. Okay, so these are the areas commonly for melasma, and the color usually very light or slightly irregular brownish but irregular shapes, and they are patchy on the early stage. When they are later stage, it will be a whole patch joining together. Yeah, and usually late 20s or mid early 30s, yeah, are the commonest age they started to have. Melasma usually progress over time. It become worsen and more obvious over time. Yeah, if you have adding triggering factors, then your melasma will show the worsening even faster. Okay, so these are the characteristic. Okay, so let's see, melasma, yes. What causes a melasma worsening? Okay, here listen properly. This is, I'm talking about what causes a melasma worsening. Later on, I will talk about what is the cause of melasma. What are the causes of melasma? What I'm talking here is what is the reason, okay, or what are the causes why your melasma get worsened. Meaning to say, once you got a melasma, what makes it worsen and showed up even more obvious? Okay, these are the triggering factors. Make it right. A lot of people thought these are the cause, but these are not the cause. These are the triggering factors which makes it worse. Okay, so without this factor, your melasma still will occur. Okay, your melasma will become worse if you have these factors. First, emotion. If you are very stressful, very depressed, very anxious, very depressed, panic, always anxious, mood, depressed, very sad all the time, your melasma will worsen easily. Don't play, okay? And then hormonal changes. If you are having a very irregular hormone balance where your menses does not come regularly, or whenever you have menses, you have a lot of symptoms where you hair loss, acne pop out, bloated, weight gain. Those things are hormonal changes. Or during pregnancy, during and after pregnancy are the timing where your hormonal changes in a very obvious form. Or when you are having a menopausal period, meaning to say transitioning timing of your menopause, then these hormonal changes will triggers your melasma to become worse. Okay, and then sun exposure and skin irritation. What does it mean, sun exposure? If you already have melasma, if you expose to sun regularly, if you always like to ride bicycles outdoor, you like hiking, you like to swim outdoor, you like to go to the beach, you like to go holiday walking around in Langkawi, Pangko Island. This sun exposure will makes your melasma worse faster. Then skin irritation. Okay, it can comes from commonly from product skincare. If you are using some skincare, and this is very common, a lot of ladies who have some pigmentation issue which is already underneath underlying melasma, but you may not know yet. You didn't see the real picture, but it's already there. The skin characters already have melasma character, but they only show up some freckles or pigmentation on the skin. You thought it's like irregular color tone. Then you started go and do a very strong laser lah, or chemical peeling lah, or enzyme treatment lah, or a kind of vinegar treatment in the beauty salon or kind of scrub treatment or seaweed scrub treatment, very famous somewhere in beauty salon all these can irritate your skin, and after that your melasma will become worse or straight away flare up. Okay, so these are the triggering factors. These are not the main cause yet. Okay, these are just the triggering factors. Okay, and another issue, if you always have liver toxics, you always drink alcohol, if you like to eat a lot of sweet stuff, sweet food, yeah, always munchy a little bit of junk food here and there, here one piece of chocolate, one piece of ice cream, one piece of sugar, another mango, durian, yeah, then one piece of cookies, one piece of cake, okay, one piece of French fries. All this, yeah, accumulatively will make your liver toxic higher. Then your melasma will become worse. Or if you always have poor sleep problem, always look at the phone very late night, 12 a.m. still don't want to sleep, still TikTok, Facebook, YouTube. If you look at my channel, then okay lah. If you look at somebody else, wow, funny stories, okay, again until 1 p.m., 1 a.m., 2 a.m., always poor sleep. Then you may say, it's not that I cannot sleep, I don't want to sleep, it's I cannot sleep, right? So, okay, if you're having sleep quality problem, your melasma will also get worse, okay? Yeah, don't blame anything else, okay? So, melasma is this way. You have to accept the true melasma is like this. All these factors is just around us or just with us. Yeah. So some you can change, some you cannot change. Okay. Yeah. But whether you change or not, okay, these are just triggering factors. It make your melasma worse. Yeah. During the treatment, we may consider this a lot because if you already treated your melasma or reduce your pigmentation in your melasma, if the triggering factor stays on, your melasma will recur, right? But what I'm talking today is actually we are looking into curing your melasma, where we want to reach a stage where your skin pigmentation of melasma reduce, lighten, and become stable. And after that, even though the triggering factor stays on, it will not so easily makes your melasma recur again. All right. So listen properly. Yeah. So this is why we are talking about this topic today. Yeah, about melasma. So if you find the topic interesting, share to your friend, tag to a friend. Don't be selfish. Okay. Today I'm not here to sell you something. I'm not here to promote anything. I just share information and knowledge because I know there are many people having melasma issue, and most of the time either you treat it, then it recur again, or you treat it, it doesn't respond, or you treat or not treat, it get worse. Okay, but you don't know why. Yeah. So the reason I'm trying to figure out, let you understand. This has been figured out, and this has been studied. This has been already proven. So you must understand, let you understand more. Okay, yeah, if you don't want to listen, then just come to us. Let me do something, the treatment for you. That easy, don't need to think so much. If you are interested to know more, to for your own benefits, then you're also welcome to ask question, then you learn even better. Okay, yes. So triggering factors are just factors causing your melasma worsen. If you don't have a melasma, this condition does not play any role. Yeah. So you must have a melasma existing. Then these triggering factors will make your melasma worsen easily, or faster. Okay. So next, why melasma worsen after treatment? Now you must understand the main cause of melasma. Why the melasma get triggered? Okay, after treatment especially, because the main cause of melasma is due to lacking of collagen or losing of collagen in your skin. And then what happens is there are capillaries dilatation and inflammation underneath your skin. Imagine if your skin is young, your skin do have a very concrete, solid, organized collagen. And this collagen is very healthy, very important as an antioxidant effect to sustain the skin health. And it makes your skin characters or skin structure together with the capillaries lining inside Stay stable, stay healthy, and you will see the skin glowing, shining. Wow, very nice, very beautiful. But the thing is, when we are starting to lose collagen, late 20s, early 30s are the starting age, okay, where you're starting to lose some collagen. When you're starting to lose collagen, yeah, the thinnest part of our face, usually the cheeks area here, will start to show a little bit of instability, where your capillaries underneath your cheeks were starting to have some response of inflammation and dilatation. Yeah, once this starts, then your pigment cells inside your skin will get stimulated and it will get it will start producing pigmentation. Because of this main cause of melasma, then that's why the triggering factors, emotion, let's say when you're sad, when you're angry, the hormone effect will actually makes your skin, yeah, collect a lot of unhealthy cytokines and free radicals, and it will make the capillaries to become dilated even more, and the dilatation and inflammation of capillaries will straight directly stimulates on your pigment cells and grows pigmentation. That's why it cause your melasma to become worse. Or hormonal changes, female hormones, especially estrogen, is the main hormone that triggers onto your pigment cells. So when the hormone changes, the we call it uncoupled. Okay, meaning to say they are imbalanced. You are having too high of estrogen, too low of progesterone in one sense, or it's like up and down. It changes very fast timing when you are pregnancy or after delivery of pregnancy. Then this triggers of estrogen onto your skin. It will makes your inflammation of capillaries become worse. Okay, then the melasma become worse. Sun exposure, definitely this one, yeah, will makes your vasodilatation, blood vessels dilatation even become more obvious. Then your pigmentation will grow faster. And skin irritation, yeah, a lot of product or treatment that actually makes your skin even damage, more damaging. That particular point, if it is on the weak skin, where your skin is having inflammation and the capillaries are actively dilated, then it will trigger it more and it will worsen the melasma very fast. Yeah, liver toxics, yeah, if you're drinking alcohol, taking a lot of these fried food, sweet stuffs, yeah, this will make your blood vessel capillaries to dilates very easily, yeah, and it triggers pigmentation growth. Okay, poor sleep quality because of uh, a lot of reasons, but anyhow, when you're having poor sleep quality, then what happen is your body are collecting a lot of inflammations, free radicals. These will collect inside your skin and it will cause vasodilatation, pigmentation, worsening. All right. So these are the causes of melasma. If you want to cure melasma, you have to reduce these two things. Yeah, you have to stimulate your collagen back. You have to make your capillaries to stable so that it won't get so easily inflamed. All right. So why melasma keep coming back, ladies and gentlemen, especially ladies, whenever you spend some money, then after treatment, wow, your pigmentation lighten, very happy. But after that, you come back again lah. Why lah? Before treatment, maybe you already asked the doctor, will the treatment makes my melasma cure permanently? So maybe the doctor say yes, maybe the doctor say no, but maybe you didn't listen also. Okay, but the melasma keep coming back is one of a true, one of the facts and one of the characters of melasma. If your skin having melasma, melasma sure will come back anyhow. The reason is because melasma is due to lacking of collagen and capillaries dilatation. Okay, so if your melasma comes back, means whatever treatment that you did, it didn't improve your collagen. It didn't makes your capillaries dilatation improve. It just temporarily reduce the blood vessels inflammation. It just temporarily lighten the color or just makes the existing color lighten only. But once the treatment stop, lacking of collagen will cause the capillaries dilatation again, and the inflammation will start again, and the pigmentation will become active again, and it will grow again. All right. So these are the reason, okay, why your pigmentation of melasma keep coming back. Yeah. So if you understand why, then logic thinking, you should aim for a treatment that prevents the melasma coming back. Whenever you look for treatment for melasma, whenever you are diagnosed your skin pigmentation issue as a melasma, you should start thinking how to cure the melasma so that the melasma won't come back. The answer is here: stimulate collagen, build capillary stability. Okay, yeah. Simultaneously, you can do whatever treatment can lighten the existing color, but at the same time, start building collagen, stabilize your capillaries, because this treatment, this effect takes time to build. Yeah, it's not one day, it's not 1 month, it's not it's not 2 months like that. It's at least 6 months to 1 year. Yeah, so you need some time to build, or else whenever you lighten your pigment in between in within 3 months or 6 months, but your collagen have not built, then only after 6 months only you want to build, it is not stable. Then within that period of time while you build, your pigmentation recur again, then you have to spend some money extra. Yeah, so these are the reason, again and again, part of our treatment protocol to emphasize in our treatment protocol, so to make sure all our patients benefit the most. Yeah, and there are a lot of people still having this issue where they did treatment, especially lasers, for their melasma or their pigmentation. They do not know that it's actually melasma. They thought it's just a simple pigmentation or just irregular color tone or freckles. They did a laser. Most of the time, because certain areas of clinics maybe got promo lah, first trial lah, cheaper lah, yeah, then straight away do. After do treatment, pigmentation, boom, come out, everything come out. Why melasma should not do laser as the first place? The reason is because the skin of a melasma lacking of collagen, capillaries are dilated. You are just waiting for the irritation only. Yeah, just now I mentioned, if your skin get irritation, yeah, especially a strong laser, you thought, oh, one time team done. But the thing is, when you do it at the wrong timing, your skin at the time are actively growing pigmentations, just collecting pigment underneath your skin. You do not know. But once you do laser, you flash everything up. Yeah, who to blame? Okay. Yeah, who to blame? Yeah. So it's not to blame anybody, but the answers here, or the what I'm trying to say is, you must understand melasma, okay, is a character. Sometimes you don't see it yet, but it's there. That's why at the beginning I showed up you all the photos where and what are the age, what are the risks, what are the condition that you will usually have when a person starting to have melasma. Yeah, late 20s, early 30s, after hormonal changes, after pregnancy, or even during menopausal, perimenopausal age, yeah, then always got some light brownish, irregular, undefined patches of pigmentation. And this pigmentation sometimes get darker when you are under the hot sun, or after alcohol drinking, or after you cooks, yeah, or after your skincare, it become irritation a bit, then it become worse, but then it lighten again. So these are the pictures that already shows that you have melasma. Okay, so if you have melasma, if it irritates it, the skin suddenly flares, is because of the blood vessel capillaries dilatation is already there waiting for you to trigger only. Once you trigger, the inflammation will form even more, then the melasma will flare or worsen straight away. Okay, it's not considered worsen, it just show you only. Just before that, it's just hidden there. Once you trigger, you ask, hello, melasma, are you there? Yes, it come out and see you. Okay, so these are the thing. Okay, so ladies and gentlemen, I hope up to now, okay, you got some idea what is melasma. So very dangerous if you don't treat melasma correctly. The protocol principles that we have been carrying on all this while to treat our melasma patient. First, these are the three principles. First is timing. Yeah, we must make sure we are doing the right treatment for the right timing. Sometimes it's not because I want to introduce you a lot of treatment, but it's because your skin needs it. Okay, we are thinking about how to lighten your pigment and also how to prevent your melasma from recurring. Okay, so we have to plan the treatment accordingly. So make sure the timing is right. When your skin is at a good timing, what to do, what are the treatment best timing to do, you have to do. okay, then you will benefit the most. Okay, so follow up very important. We need to make sure that you are always being closely monitor and follow up to make sure your progress is within the expectable. Sometimes you may not know, or you may not expect, yeah, certain outcome, which in experience, or which in fact is a kind of natural or a common thing where the skin turns into this so kind of condition after the treatment or during the treatment process. So these are the things that we need to make sure, and also to let you understand, yeah, during the follow up. Yeah, and follow up also to make sure that at least we know what conditions, how much your skin has improved, and at what stage your skin is, yeah, that you can proceed for another better stage or phase of treatment to make your skin even better, and eventually reaching a stability where it treat until your melasma cure, where your root cause problem has been rectified. So it means your collagen has built back, and also your blood vessels capillary is stable, no more easily inflamed anymore. All right. So these are the treatment protocol or principles that we have been carrying on, yeah, so for many years, and this is how we are able to successfully treat many patients with melasma, yeah, with first not causing the pigment to become worse, yeah, and selecting the proper treatment at right timing will benefits the patients most, because you will have the most effective or most effective effect of the treatment during the best timing of your skin, yeah. And close monitoring and follow up is to make sure that if your skin is not responding as accordingly, then plan B, or another options of treatment which is more suitable should be considered, rather than keep on doing the same treatment and wasting time, wasting money, right? Okay. So during the treatment of melasma, we must treat, okay, all these triggering factors. But treating these triggering factors do not cure the melasma yet. Yeah, but we must treat. If you have emotional problem, you need to consult. You need to change your emotion. Some supplement, yeah, have effect to make your emotion better. Yeah, do consult us if you want to know more. Yeah. Hormonal changes issue after pregnancy, after perimenopause, yeah. If this factor is the main triggering factors, then we have to look into it and see what can be done. Yeah, there are also supplements that can help. Okay, sun exposure. Yeah, if you are coming for melasma treatment, don't say that you don't like to apply sunblock. Then we are sweating already. Yeah, okay, because you always let the triggering factors there. Yeah, stays on, then how to treat your melasma then, okay? Then skin irritation, yeah, don't say that you have a lot of products here and there, you are still having that treatment, that center, this center, you want to do finish first. If it is no good, don't do, even no helpful at all, right? So avoid irritation, don't use product that's scrubbing, irritable, like a lot of serum, a lot of high nutritious scrub, mask, things like that, okay? Settle down, calm your skin. Yeah, most of the time your skin needs as little as what you need, so you do not need a lot of things actually. Stop alcohol, stop sleep late, stop smoking if you are, and also eat healthier, eat more supplements. Yeah, there are supplements specifically for skin melasma also. Yeah, you can let us know if you're interested to know more. Okay, yes. So, ladies and gentlemen, so far are you okay? Yeah, if you have questions, you please ask. Okay, I am more than happy to answer all your questions. Yeah, okay. So must treat the triggering factors to at least makes the progress more smoothly, better, yeah, and you will not see the rebounds of your melasma very easily. And then how to treat your main cause of melasma to reach or eventually to achieve a cure, yeah, so that your melasma will not trigger anymore. Your melasma will not come back anymore. Okay. So the aim is to stimulate collagen again. Stimulate collagen again. The technology, latest technology, we are happy to show every one of you called Potenza. Yeah, Potenza is the name of the technology from US, and this is the latest and also the most advanced technology for radio frequency microneedling, targeting our basal layer of the skin to regenerate collagen effectively and to stabilize your capillaries inflammations. All right, so Potenza is a micro needling radio frequency technologies, very advanced, newer design from US, FDA approved. So it has been shown effective results to reduce the melasma recurrence by improving the skin collagens and reducing the capillaries dilatation. The proof is there, evidence-based studies, yeah, and the purpose, yeah, or the effect of the Potenza is to build collagen, strengthening the capillaries. Yeah, a lot of people may ask, "You, I'm old already, my skin still can grow collagen." Answer is we must have a techniques that can have effectiveness that can stimulate your collagen. So how to stimulate your collagens regardless whether you are old or not? First, we must stimulate the basal layer. Basal layer is a layer of cells which contains stem cells inside your skin, and the layer sits between your epidermis and your dermis. All right. So this layer is very thin and it's actually a wavy layer. So we must have a technology to stimulate this layer. So how to stimulate? Either a direct mechanical injury, so we use micro needling, and then simultaneously the micro needling will deliver a temperatures from a radio frequency technology, and this temperatures is good enough, just nice to stimulate the collagen cells to grow, the fibroblast cells to grow, and then to grow collagen, and it will build collagens again. Once the collagen is building up, the capillary structure and the skeletal folds, the scaffolds of the collagen will become more organized, and then your skin will become healthier and it will become stable in terms of your pigmentation. Then your melasma will become more stable and lightened, and then the recurrence is lesser. All right. So, ladies and gentlemen, Potenza is the latest technology. Okay, I don't want to repeat many times. Here I mentioned Potenza, okay? And this is currently available in our clinic here, and you are welcome to ask us more for information, all right? So these are the before and after photos that we want to show some of the cases. This is before, you see pigmentations here, and it's lightened after the treatment with following our protocols, yeah, which we focus on the emphasizing a good timing to do the right treatment, right timing to do the right treatment, and also close monitoring and follow-up is very important to make sure the successful rate is higher. And then we must treat the root cause for the cure, which we must build collagen and reduce inflammations, simultaneously to treat melasma, or else your melasma will recur, or else your melasma will rebound. Yeah, so very important to treat melasma. The focus point is to cure, is not to just stabilize or lighten it. Then no point. Okay, so you see the redness, which is a dilated capillaries, has been lightened. Yeah, but here the skin quality is still not stable yet. Yeah, you can see a lot of still patches of dilated capillaries still building up. Yeah, we are still building up the collagen. Yeah, so by one day, if it is lighter and lighter, then means your skin's collagen scaffold has been well organized and your capillaries will be better already. All right. So next, you can see a pigmentation patch here. Yeah, which lighten after this is just a shadow, and the capillaries dilatation inflammation has lightened a lot after the treatment. Yeah, this again emphasize on the cure for melasma. All right. So you can see here, yeah, the pigmentations of the melasma then lightened after the treatment. So this is the patch of blood vessels capillary, means active melasma. And after it's lightened, okay, it's still not cured yet because it still got some capillaries, it's still ongoing. Yeah. So yeah, but this is a direction. Once the direction is right, it's just matter of time to accumulate and to achieve that. Okay. So these are the pigmentation issue. Even though you don't see very obvious changes, but on underneath the skin, you can see the blood vessel has shrunk a lot. So it actually stabilize the pigmentation from coming up. Yeah, this patient will catch up early, even though patient comes or just light pigmentation, thought it is just a normal freckles or pigmentation, but actually once after the photo done, we catch it is a kind of melasma. So patient did not proceed with any laser. He just done certain treatment to stabilize, Yeah, then after that, collagen stimulation will be the choice and to aim for a reduction of the inflammation of the blood vessels. Okay, all right. So, ladies and gentlemen, almost end of the topic discussion today. If you want to have a beautiful skin, we are not treating melasma, but we are curing the melasma because the cause is the unhealthy collagen, disorganized collagen scaffold, and also dilated inflammative blood vessels and capillaries. So aim for this treatment. We have a latest technology part of our protocol, to treat and to improve your skin quality. Of course, melasma is not simple to treat. Timing is very important. Yeah, catch the right timing, do the right treatment at the right timing, and then close monitoring is very important. This is what we have been doing. Yeah. So then after that, simultaneously build your collagen, stabilize your blood vessel capillaries will be the long-term outcome where we are establishing for all our patients for melasma treatment. All right. So hope every one of you who are having melasma don't do wrong treatment at wrong timing. Okay, make sure your skin has been followed up closely so that you are not wasting money at one treatment which is not doing well. Okay, and supposedly you should aim your treatment for melasma towards the root cause. Cure where it reduces the blood vessels capillary and improve your collagen. Yeah, so your treatment plans should aim on this. It's not just apply cream and you see lightening and you're happy enough. It's just temporary only. Yeah, then you don't blame. If you do so, you don't blame saying that, oh, the cream doesn't work. When you apply, you lighten, then you if you don't apply, then it recur again. The cream is working. Yeah, but the thing is your melasma needs something else more, not just a cream. Okay, you understand? All right. So yes, you are smart. You can understand. All right. Thank you very much, ladies and gentlemen. Get in touch with us. Yeah. So you can contact us and visit us in our clinic here in Kota Kemuning. All right. So our phone here to contact by call or WhatsApp 017-781-5237. Yeah. You may also visit our website, okay, www.revivalclinic.com. Email us revivalDoctor@gmail.com. We also have Instagram and Facebook. Okay. You are welcome to follow us online. We always post we'll keep our posts updated all the time. Okay, so and bringing you more interesting topics and information as well. And then if you would like to have a consultation with us, feel free to call us, to WhatsApp us, to message us, to drop us an email. Then we can analyze your problem. And then we'll let you know what is your treatment needed. Okay. Thank you very much again for all your time and your questions. And thank you for joining us here in our Facebook Live. And I welcome every one of you to join our Facebook Live on every Wednesday, 1 to 2 p.m. is where our time here to share information and share knowledge and answer all your questions and doubts so that you can be healthier, beautiful, and I wish every one of you live beautifully without melasma. Cure melasma together. Yes, thank you very much. Okay, bye bye.